Hi, I'm Neeraj Bhasin, vascular surgeon and chair of the Circulation Foundation. I'm delighted to be able to welcome you to our first ever podcast. This podcast is designed to launch Vascular Health Awareness Month, but also start the celebrations for our belated 30-year anniversary of the charity. The Circulation Foundation has three aims: to raise awareness of vascular disease and vascular health, to support our patients, but also to raise funds to support really vital research. We're really grateful to Jill, our patient, who's been so open about her journey with peripheral arterial disease and interestingly talks about the origins of the Body Walk. The Body Walk is our fundraising event that's happening through the course of this month, and there's plenty of time for you to get involved with that. Really grateful to Laura and Sean, our fundraisers, who share their inspirational and emotional stories and their reasons behind why they chose to fundraise for the CF. And then also massively grateful to Ellie and Penny. Those are our Circulation Foundation funded researchers who describe how they're using the funds to create a better future for our patients and to improve the service we can offer to our patients. So I hope you enjoy it and I hope you find it interesting.
My name's Jill Holman. I am 67 years old. My condition I have is called peripheral arterial disease, and it's commonly called one of the most serious diseases no one's ever heard of. So the impact that peripheral arterial disease had on my life initially was pain on walking, claudication in the back of my calves and the back of my thighs. But I did what I was supposed to do and did all the walking, and I was thinking I was getting on top of the disease, and then actually it then overwhelmed me. I then had to have some surgery. I had an endarterectomy done, which I hoped was going to sort it all out. We all hoped it was going to sort it out. Turned out that not to be the case. I had to repeat endarterectomy, lots and lots of angioplasty. But we were talking about raising funds and what we could do as a family. My son came up with the idea of travelling the arterial system. Then we found out it was actually 60,000 miles, and he didn't think he could do that all in one go. So we thought, well, maybe we could sort of set something up where we got everybody involved, just to do a bit of it. If you can only do 2 miles, that's 2 miles of it done, And anyway, I mentioned this to Paddy in surgery one day, and he thought it was a brilliant idea, and I contacted Rachel again, and that's how it all started, and we got involved, and it turned out to be such a good idea. I was really pleased that it's all been taken forward. So it's a good one.
Hi, I'm Laura Shields. I'm a financial controller, a qualified accountant of many years, and I live in a town called Paisley, quite near Glasgow. I live with my husband and our cat, Blue. So it was really started back when my mum took unwell. She was diagnosed with advanced vascular disease. And we'll probably come on to that about my why, but so that's why I kind of reached out. And it was really purely to do with being in amongst the hospital environments, with my mum going through the process of various appointments with doctors, GPs, podiatrists. And I think it was more when I lost my mum, I looked around me and I thought, my word, these people are inspirational, because my mum was one patient amongst many patients that I'm sure you have as well. And I think I just wanted to give back, because I thought my mum was selfless in life, and I know that she would want me to do something to say thanks and give thanks for everything that was done for her. And sadly, her case is quite sad. Unfortunately, we lost my mum, but it just gave me that inspiration to say, how can I say thank you? you know, it's a card, chocolates, it just didn't seem enough for me. And being a natural runner, because that's what I love to do, I run lots of races, and I thought, I just need to find out how I can do something to give back. So obviously I lost my mum in February last year, and I'd already signed up for the Edinburgh half marathon because I do like to run the half marathon. I quite enjoy that. Marathons for me would probably kill my joy of running, so half marathon is where I like to stop at. So it was kind of natural. I lost my dad a number of years ago, and running helps. You're probably aware, like mental health, running really helps with that. And when my mum was really sick, and my dad also said, never give up your sports, live your life to the full. They were so pragmatic, both of them, at the end. And she said, you know, my life is, I can't believe I'm sitting here now, my life is over. However, do not mourn me. So I thought, well, that's going to be easy. Not. And then, so I thought, right, I need to do something to keep myself focused. And I'll be honest, you know, you know, losing any loved one is very difficult and very hard, especially my mum. She was like my rock, my best friend, but running helped. And I thought, right, let me do something to give back. And that's how I ended up doing the Edinburgh Half Marathon, and, you know, just getting the funds out there from our friends and family. And a lot of friends and family supported that because they felt rather than give flowers, give to the charity. And that's kind of what we did. What I will say is, and I think it's probably part of the research is going to help this as well, and it's not a well-known charity, it's quite a small charity. And obviously every time you run, you see your British Heart Foundation, you see your cancer research, and I'm not belittling any of those because they're all amazing what they do. But everyone seems to be focused on that, and so many times I got stopped that day and said, oh, what charity is that? I've never seen that before, and what's your story? And, you know, it was kind of getting that kind of, I felt quite proud to be running for the Circulation Foundation, because I thought if this gives even one person to Google Circulation Foundation, like circulatory diseases, then, you know, it adds a bit of awareness. And so I raised £1,500 during that race, which I was really happy about. I also got a personal best running as well, which was even better. And it was such a great day. And then this year, obviously I follow the Circulation Foundation on Instagram, and I noticed they had spots for the Great North Run, and I thought, oh my word, I couldn't possibly. And it's being a half marathon runner, you're probably aware that the Great North Run is the largest half marathon in the world, and it's the one that everyone wants to run, some of them probably London Marathon. And every year I've tried to be successful in the ballot, and every year I've been unsuccessful. But this year I thought, I wonder, and there we go, I've got a spot at the Great North Run, and I'm absolutely overwhelmed. I have a space. It's, to me personally, it's just an amazing, you know, achievement for me to be able to run in that race, but then to also raise funds for a Circulation Foundation that's so close to my heart, and it's just amazing. The nurses are so busy and rushing off their feet, and I think, you know, I was in awe, if I'm honest, because my mum was treated as an individual and very important patient, but so was the next patient and the next one after that. And I think it's that dedication to helping people, as well as the surgeons, and every surgeon took the time to discuss everything with me as a patient's, you know, relative, to understand what was entailed. And it's really the awareness, because if I'm honest, I was totally oblivious to what peripheral vascular disease entails. You know, from my mum, it started with stepping on a piece of carpet gripper in the spare bedroom, to suddenly, this was in the March, April time, to suddenly having her leg amputated in the December. Firstly, we were hoping it was just the foot, and then it was too far gone and it was above the knee, and then another part had to be amputated. And by the time January came down, I think it was just far too much for my mum's body to cope with. And unfortunately, we lost mum, and it just happened so fast. You know, and for me as well, it's to say thank you to I know you were my mum's surgeon, but it's just to give thanks to because, you know, I'm a professional person myself, and I spent the last kind of week with my mum in hospital. I was lucky enough, they have a vascular annex where it's for complex discharge, for patients obviously who have lost a limb, and the whole life has changed, and the way they live is going to change at home. And obviously it's also there for parents or patients that are in palliative care. And during my whole time there, it was like, my mum was one patient, but you're doing that day in, day out, and you're seeing various different levels of outcome, and you're dealing with that, and for me, it's like, I'm actually in awe. I will be honest. It's just amazing to see the success stories, but obviously, how you deal with that as a surgeon, and nurses and all the allied health professionals that go into helping these patients. It's just, I'm saying thank you to you, because you do everything to try and let my mum, survive and fight the disease, but unfortunately, that wasn't to be, and they tried everything, and that's the thing. You go to last ditch attempts, for want of a better word, to try and help the patient and survive and fight the disease, and I just think I can't thank you enough.
I'm Sean Palmer. I'm an exercise physiologist based in Hull, and my day-to-day role essentially involves working with various patients with vascular disease, so that's the peripheral arterial disease, by providing supervised exercise programs for those as the first-line treatment, but also running a nurse-led claudication clinic where we see patients who are referred with what the GP suspects might be intermittent claudication, and we just perform a simple ankle breaking pressure index before and after a treadmill walking test, just to try and diagnose or rule out intermittent claudication based on that. And then I also work closely with patients with abdominal aortic aneurysms, performing our cardiopulmonary exercise testing. So patients who are due to have surgery or indicated to have surgery due to the size of their aneurysm come for a cardiopulmonary exercise test to assess their fitness for potential intervention, to guide the joint decision-making process between the surgeons, the patients, the perioperative physicians, and also the vascular radiologists. The fundraising event that I did was the Manchester Marathon back in April of 22. I'd say the main challenge, or the biggest challenge undertaking it, was actually that I wasn't feeling particularly well that weekend that I was supposed to run the marathon, and had actually decided that I wasn't doing it the night before, and then having woken up the next morning feeling slightly better, decided that I was in Manchester. I'd already made the effort to get there. I'd done all the training, so I was going to do it regardless. And actually the biggest achievement was then, of course, getting over the finish line in under 4 hours, which was the target that I'd set myself at the beginning. But actually the biggest enjoyment for me was getting out and training in the months leading up to the event, and living out in towards the countryside. It was easy to get out running and down the country lanes, but also wearing the Circulation Foundation T-shirt and prompting conversation with people that see me out and about running, because you tend to see the same dog walkers, the same people. So when you then see them when I'm out walking my dog, for example, or going to the pub, then it sparks that conversation. Well, what's the charity that you're wearing on the T-shirt? And we talk about and try and raise awareness for the Circulation Foundation. And then, of course, the overall achievement was raising over £1,000 for the charity, which was something I was really proud of. Yeah, really. So the main reason for choosing the Circulation Foundation was just because I see the impact that various different vascular diseases has on a patient in their day-to-day life, and how much their life can be impacted by vascular disease, and that ranges from sort of minor venous and arterial disease right up to ruptured aneurysms and things like that. The scale of the different diseases that people may come in contact with is quite significant, and the spectrum, as you can think of, is very, very broad with regards to vascular disease. But I think it's so important raising awareness of the Circulation Foundation, because it isn't well known in the UK, or as well known as it probably should be. And it was actually really good to see when I was running around the the marathon, someone just shouted Circulation Foundation at me. I'm assuming that was to try and encourage me to keep going, but it was just, knowing that we were getting that exposure for the Circulation Foundation was something that I thought was really important. And if I can try and make a difference to help some of the patients that we see in a different way to just what we do at work, then I felt like it was something that I should have done.
So my name's Ellie Atkins. I'm an ST7 vascular surgery trainee in the east of England, and I'm lucky enough to be, approaching the end of a 2-year research fellowship funded by the Royal College of Surgeons of England and the Circulation Foundation, based around the peripheral arterial disease quality improvement framework. So we know that chronic limb-threatening ischemia has really poor outcomes in terms of limb loss and mortality. We also know from Andy Nickinson's work at Leicester that there are delays at every stage of the process of management of chronic limb-threatening ischemia, from the patient developing that symptom to getting treated. So looking for earlier and better diagnosis of peripheral arterial disease, and also making it easier for patients to get some help for their symptoms. At the end of my research, I hope to come up with a strategy for quality improvement to improve that process to diagnosis for people with chronic limb-threatening ischemia, which will be informed by all the work I've done. So it'll include views from patients and primary care clinicians, as well as vascular surgery clinicians. So we know that delays to definitive treatment for chronic limb-threatening ischemia increase the risk of mortality and limb loss. Earlier diagnosis means earlier treatment, and earlier treatment means fewer limbs lost and fewer lives lost. I guess clinically, I'm really interested in limb salvage, both open surgery, so complex distal bypass, as well as complex endovascular surgery. So I went to Australia and did a year's fellowship in Adelaide, working on endovascular skills predominantly. And so that, as my clinical interest, I want to make sure I'm delivering the best care for the patients across that pathway, not just at the treatment end. So if I can do something to improve the care throughout the patient population, then I'd be really happy. Well, things coming out of my research is there are really improvements to be made across the board in terms of awareness. And that's not just for patients, it's not just for primary care clinicians, but it's for secondary care clinicians, it's for nursing staff, it's for absolutely everyone to ask for help. The Circulation Foundation pays half of my salary, so I genuinely wouldn't be able to do this work without their help and support. And Circulation Foundation obviously relies on donations from the public to keep going and to fund this really vital research that is improving care. I mean, you've spoken to Penny Burnpilly already, but we know the peripheral arterial disease quality improvement programme, which was, she is like me, funded by the Circulation Foundation, and that has improved care for patients with chronic limb-threatening ischemia, and it's led to improvements across the whole country rather than just the cohort of centres involved in that quality improvement collaborative, and that's all been driven by the Circulation Foundation. I did some fundraising for Circulation Foundation as well. So in 2018, I ran 5 marathons in 5 months, and including London, which I'm really grateful to the Circulation Foundation for that. So I could do London because it's such a great event. And yeah, again, I wouldn't have done it without them. So yeah, thanks to the Circulation Foundation for that.
Hello, my name is Penny. I am an NHS doctor currently working in Oxford. I recently completed my PhD with Hull York Medical School, supervised by Prof. Ian Cheddar, and that PhD was partly funded by the Circulation Foundation. So my PhD looked at the delays in the treatment of patients with chronic limb-threatening ischemia. That is a condition that's the most severe form of the peripheral arterial disease, otherwise known as PAD, which is blockages or disturbance in the circulation of blood into the legs and the feet. It's very common in patients with diabetes, but it can also happen in the rest of the population. And those people have pain in the legs when they're walking or at night. And there is a belief that the faster we treat these people, either with an operation, an open operation, or with an endovascular procedure with stents and wires, then it possibly improves their outcomes and reduces the risk of having an amputation or losing the leg. And therefore, I looked at what factors are affecting the time from the time the patient presents to the vascular surgery team to the time that the patient has their operation or their procedure. We developed a quality improvement program with 11 participating hospitals across the country, and the teams in those hospitals tried to make little changes to their vascular service to try and reduce the time it takes from admission to the hospital to a patient having a procedure for this condition. Patients were treated faster. We haven't looked in detail on whether this has reduced amputations in the long term, because this may take years to have this data. But most of the people in the program felt that the patients were happier because they were treated faster. They had to wait for a shorter time. And we also found that the vascular teams were happier because they felt they were giving the best service possible to the patients. So with the grant that I got from the CF, I was able to take time out of program and devote time 2 or 3 years. It was a 2-year funding to look into this condition full time. And I also got the opportunity to work with people at the National Vascular Registry who have the details about the vascular procedure. Then we were able to do work on this topic of delays, and it also gave me the opportunity to discuss and liaise with Vascular Society members who led this program in their respective centers. So I felt the financial support from the CF was crucial because of this, and it also allowed me, of course, to get a PhD, and I hope to continue research on this topic and reduce health inequalities in general, and for patients with peripheral arterial disease. So I feel it is important to donate for this cause. This is a very common condition that a lot of people suffer from. Some of them don't know it because they feel that getting tired or feeling some pain after walking a long distance may be normal, and therefore donating to the Circulation Foundation may raise awareness and may also support other researchers who continue this work.
Thanks so much for listening to our first ever podcast. I hope you found it interesting and informative. Please feel free to share this across whatever social media platforms you use to raise awareness, both about vascular health, but also the Circulation Foundation. Do visit our sites and follow our social media outlets, because there'll be daily outputs throughout September to mark Vascular Health Awareness Month. There is still opportunities to get Circulation Foundation t-shirts and our awesome hoodies. We're very, very grateful to all the contributors of this podcast for bringing this to life. And we're so grateful for all your support for our charity. If you would like to contribute, if you would like to get involved more, the details of how to reach our website and also how to contact us follow us on this slide. Thank you and see you again.